Hello, Mrs. Williams. As you transition out of hospital care and back into your home, there are several things that we would like to instruct you on so that your care and healing process from your stroke will be as smooth as possible. Through this video, we will be teaching you about one of the medications that you will be taking. This drug is called Coumadin, or is also generically known as warfarin. While you were in the hospital, you developed a blood clot deep within a vein, which is known as deep vein thrombosis, or DVT. This was likely due to the amount of time that you spent in bed while you were healing. Coumadin is an anticoagulant, or blood thinner, which will help prevent your blood from clotting and forming complications like DVT in the future.
As you take the prescribed amount of medication, there are specific things you need to be mindful of as you determine your diet. Vitamin K is a substance in your body that encourages clotting by stimulating key factors needed for clotting, such as a substance called prothrombin. The role of Coumadin is to interfere with these components so that your blood will not clot when it is not supposed to. It helps blood flow smoothly throughout your body by decreasing the activity of clotting components in your blood.
Because of this, it is important to avoid foods that are rich in vitamin K so it does not defeat the purpose of the Coumadin working in your body. These foods would include things like asparagus, beet greens, Brussels sprouts, broccoli, and many others. We also encourage you not to drink cranberry juice or any form of alcohol while on this drug therapy. Alcohol can increase the action of Coumadin, which could be very dangerous.
When going to follow-up appointments at the Coumadin clinic, you will be able to ask the nurses and doctors there any questions you may have. While taking your medications at home, there are a few things we want to look out for. First, be sure to report any signs of unusual bleeding. This could be if your gums start to bleed abnormally, if you experience unusual nosebleeds, bruising, or pain. Also, notify your provider if you have a blackening of your stool or blood in your urine.
Additionally, if you notice any change in skin color or temperature, notify your healthcare provider immediately. It is important to have frequent lab tests to monitor the levels of your blood. You also need to be aware that taking this medication with certain prescription and over-the-counter drugs, such as aspirin, ibuprofen, or herbal products, can be very dangerous. Doing so can increase your risk for bleeding. Ultimately, it is crucial to maintain consistency throughout the duration of your therapy, and do not add or remove medications without first consulting with your healthcare provider. Thank you for your time, Mrs. Williams. We hope you get well soon, and we are here if you have any questions.